Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very well-respected medical doctor from New Delhi, India, Dr. Shuchin Bajaj. Dr. Bajaj, welcome to the show.
Thank you very much, sir.
Thank you.
Very
Dr.
happy to be
Bajaj,
here.
thank you. Dr. Bajaj is the founder director of the Ujala Cygnus Hospitals. They have 22 hospitals with 2,500 beds, and they have a vision to provide super specialty and emergency healthcare to district towns of the states of India where no such facilities currently exist. Dr. Bajaj has also been awarded the Global Social Entrepreneur of the Year by the Schwab Foundation and the World Economic Forum. But Dr. Bajaj, let me start by asking you, can you share the inspiration behind the founding of Ujala Cygnus Hospitals and the story of how it all started?
Yeah, I think like most entrepreneurs, I was also an accidental entrepreneur. So I come from a very resource constrained background. My parents were refugees into the country, and my father, in his initial days, used to make and sell kites for a living, sharing a horse stable as an accommodation with 11 other people.
Amazing.
So I got through medical school, and in India, if you're lucky enough and hard working enough to get through those medical entrance exams and get into a government college, the financial part is pretty sorted, right? So my annual fees would be 400 rupees or something, I remember. So I got into a medical college and did my MD in internal medicine, and then I was pursuing gastroenterology at one of the biggest hospitals in Delhi. And I had come back to Delhi after 10, 11 years of studies because I had been outside for my MBBS and MD. So when I came back, I used to get a lot of calls from my friends and family that were living around Delhi, mostly in Haryana at that time, that somebody's had a heart attack, somebody's had a head injury, we are bringing them to Delhi. Can you please help us? They are very critical. So on the one hand, of course, it felt very nice that now I was in such a position that I could help these people. But on the other hand, it always kept troubling me that why were these people traveling 5, 6 hours in an emergency, bringing their patients in hired jeeps and vehicles because ambulances were also not very
Right.
easily available.
Right.
And sometimes I kept waiting for them all night. Cell phones were not very common. And the next morning, I would get to speak to them, and they would say, "Oh, doctor, Saab, the patient died on the way, so we are back in
Oh,
the village. We turned around." And when I went to their villages for the funerals, I would hear stories again and again saying that, "Oh, sad that he died, but maybe it's good that he died in a way because the last one that did manage to reach Delhi spent 15 days in the hospital. His family sold their house and their fields for the treatment, and then he died. And look, now his widow is begging on the streets with her children. At least this family has something to live by because they did not spend on him."
Right.
So these stories came again and again, and I started realizing that poor financial and physical outcomes were extremely common in small towns outside the big cities where we live. We don't understand this, and I started reading up on statistics. So more than 6 crore people slip below the poverty line every year in India just due to healthcare costs, and more than one fourth, 25% of every admitted Indian, whether they are admitted in government or private hospital, doesn't matter. Every fourth person has to either borrow or sell some asset or borrow from somewhere to pay for the medical bills. So I thought that, being in Delhi was nice, but what difference was I going to make? I mean, I was amongst 20,000 other doctors. So I thought that I was not really needed. So I dropped out of the gastroenterology program to start this journey into providing healthcare for small
Fascinating.
towns. So I'm a certified college dropout. So very well equipped to be an entrepreneur.
Fantastic.
So that
Fantastic.
is how this journey started of trying to provide high quality services in
And
small
what are some of
towns.
the core values that guide the Ujala Cygnus hospitals? And how do these values influence your approach to healthcare?
So we are very conscious of the high quality services that we provide, because see, poor physical outcomes is the first thing we are trying to address, that people should not die on the way, people should not die unnecessarily. So we provide the best quality healthcare in that particular town wherever we go. And that quality is something that is both objective and subjective. Subjectively, you can actually see and feel the quality that is provided to you. The doctors that we have are very highly qualified, the nurses are highly trained and very motivated. And objectively, also, all our hospitals are NABH accredited, which is the highest possible accreditation you can get in India for hospitals.
Right.
We provide facilities like cardiac surgery, medical oncology, surgical oncology, joint replacement, trauma, intensive care, everything. And we are very sure that if you are providing for the poor and the disenfranchised, doesn't mean that you can be poor quality. So, and we make sure that we use those services ourselves, right? My daughter was born in one of our hospitals. My son has had two surgeries in one of our hospitals. Our partners have had multiple surgeries and treatments in our hospitals. Second, that we are conscious of is the poor financial outcome. That is the second thing we try to address. So, whatever these high quality services we provide, no compromise on that. We try to provide it at the lowest possible price. So, sometimes our prices are as low as less than 20% of big city hospitals for exactly same procedures and outcomes. So, we have been champions of low cost healthcare. So, what we are trying to do is flip the classical private healthcare model into a traditionally what it has been a high cost, low volume model. We are trying to flip it into a low cost, high volume model that can provide services to as wide a range of people as possible.
Well said. But the other thing that is very interesting, Dr. Bajaj, is that you operate in regions with limited access to specialty healthcare. What are some of the challenges you face in bringing advanced medical services to these areas?
So, as I said, we operate in places where we are actually needed, right? If
Correct.
you are unfortunate enough to have a heart attack in, say, a town like Kethal or a Sitarganj, even if you have 100 crores in your pocket, what can you do, right? Because you will need to travel to, say, Patiala or Chandigarh or Bareilly to access healthcare in an emergency. And that may be anywhere from 4 hours to 6, 7 hours away, depending on traffic, road conditions. So, what do you do? And that is an unnecessary death in my point of view. If you die, if a young person dies of a heart attack or an accident because they could not reach hospital where the treatment is available, that is a loss to the economy of running into crores of rupees, because their future earnings and their future productive years are lost. So challenge, of course, is to first of all convince enough good doctors, nurses, paramedics, and staff to go and work in these towns. Right? It is usually aspirational if you are well educated, studied well enough to go to the big city. That is the traditional journey that everyone follows. And I've faced a lot of flack for it from my family, friends initially, and from other people as well, that you are trying to go the other way. Na? Ulti Ganga baha rahe ho. People come from small towns to big cities. You're already in a big city. Why do you want to go back to small towns? So convincing doctors and nurses that this is something that is needed, that is something that is useful for you as well, for your career growth as well, for your academic growth, for your financial growth, is something that earlier used to take a lot of time. Now people do understand that this is happening and it has happened again and again. So they are convinced. Then, of course, we face this burden that the doctors and nurses, of course, need more money to go work in the small towns. They view it as a punishment posting, right? So they need salaries which are higher than they would get in the big city. But the community wants to pay lower, right? So this gap increases more, that the community has lesser money there, but the costs are actually higher. People feel that costs will be lower running in small town, but they're actually higher to run a hospital in a small town, because we have an intensely human resource centric industry, and human resources are our biggest cost. So those are the challenges we face regularly: getting very good quality, committed, passionate talent, which is not thinking really about the money, but about making the difference in the life of the community. And second, arranging enough finances and management bandwidth to make sure that we operate a profitable running model because it is a sustainable model. We don't get grants or aid from anywhere. This is a social enterprise. We are self-sustaining. We make sure that we have enough money to keep the operations running as well as expand to new units.
Great response. The other question that you mentioned a few minutes back was that your costing is barely 20% of the others. My question to you is, how do you approach the challenge of making healthcare so affordable? And how do you maintain high standards at such low costs?
Yeah, so we have a model that is intrinsically attuned to this low cost delivery. First, because as I said, I started out with just an idea and no money in the pocket. So I barely had 20,000 rupees in the pocket when I quit and thought of starting services where currently, routinely, if you see a super specialty hospital like ours being built in a big city, routinely the budget is 1.5 to 2.5 to sometimes 3 crore rupees per bed. So if you're thinking of setting up a 100-bed hospital, routinely they would say 150, 200 crores. If you went to make it really nice, 300 crore budget. I had 20,000 rupees to start out with. So intrinsically, the model was attuned to low cost. So we do not own any land, asset, or building, right? All the buildings are on lease rentals. So we do not spend money into building the hard facility in any case, because that doesn't really make a difference. If you are treating a patient in a rented building or a owned building, doesn't make a difference to the patient. Then we prioritize our capex spend very, very thoughtfully, that we spend only on products which make an actual difference to the patient outcome. We don't try to gold plate our assets.
Right.
We make sure that we run a very neat and clean, high quality, but not a luxurious facility. Third, we OPEX spending is also very carefully thought of. So we prioritize making efficiencies in our supply chains very, very strongly. So our supply chains are very strong. We know the suppliers of suppliers. We know the cogs of cogs. We talk directly to manufacturers, go to the factories to source things. We don't let distributors, retailers take margins in between. So we try and we lay a lot of emphasis on that. Then most of all, our human resources, which is the biggest expense, we try and make sure that doctors, nurses, etc., are all on fixed salaries predominantly and very little variable pay. So that addresses actually other concerns also. If you do not have a lot of variable pay, the doctor is not incentivized to do unethical work, right? Because they are fixed salary. So if you need a stent, you need a stent. If you don't, there's no one going to put in stent unnecessarily because nobody has any incentive of doing that. They are not going to earn extra. And second, it allows us to treat each and every patient coming in, which is our core ethos. We do not turn away any patient due to financial reasons. That was the ethos on which the organization was built. They built reasons that people are dying on the way. So we want to prevent that.
Right.
So it was not built to earn money. I could have earned a lot of money if I had been a gastroenterologist in Delhi, right? I would have been much, much more affluent at that time. But so if the patient is coming, the doctor is not bothered whether the patient is going to pay or not. She is not going to ask, "Are patient, is the patient paying money? Should I come to treat the patient and put in a stent?" And third, as I said, financially works very well for us because as the volume grows, as soon as you reach a certain Rubicon of revenue, now more than 50% of it starts flowing into your bottom line because you do not have to share it with anybody. The rentals are fixed, the salaries are fixed, utilities are practically fixed, and we are very, very efficient on supply chains and consumables. So that cost is very low. So we start earning money once the revenues go beyond a certain level, the numbers goes beyond a certain level. So it is all a volume game. We run on a fixed cost model. As if we can build revenues in a hospital, we will earn money there. And see, making profits is necessary for survival, for living, right? But we need to make a difference between profits and profiteering. So we do not look at profiteering, we look at making sustainable profits.
Well said. And how are you using technology and digital services to be able to run 22 hospitals and 2,500 beds?
A lot. So actually, I come from a time when I said, you know, cell phones were not even that
Yeah.
common. So when I started out, we had nothing like smartphones or WhatsApp
Mm.
or
Mm.
image transfers on the phone on a
Yeah.
real-time
Yeah.
basis. So when I started out, I was the main clinical person in the hospital as well. So I have traveled actually at 3 a.m., got out from my house and went to the hospital half an hour away and saw the patient to just to see a normal ECG, because the patient had come in with chest pain and the residents were not very sure that what is
Right.
the ECG showing. We are not sure, the patient's chest pain is not, so I used to wake up and go and see the patient and say, okay, don't worry, it's a normal ECG, you start this treatment and come back. We
Mm.
had no luxury of getting ECG on the phone, that okay, we can see the ECG on the phone. So we started from there, but then we started using a lot of technology, because I really truly deeply feel that whatever you money you are spending on technology is not really an expense, it is an
Mm.
investment and it gives returns multifold. So our supply chains, as I said, are completely automated. We see a lot of technology usage there to make sure that they are efficient, procurement is efficient,
Mm.
purchases are
Mm.
at the best price. We do a lot of technology on helping our patients get into appointments, get
Mm.
their reports online so that we don't have to print all those reports. We try and do as paperless operations as possible, which is sustainable for the environment as well as cost effective for the organization. We employ decision support systems for our clinicians so
Mm.
that they get decision support systems online in a real time basis in the casualty emergency room, so that errors are minimized and we don't need to keep upskilling or training them all the time through
Mm.
physical means. Now we are also exploring interviewing and assessing clinical capabilities online through AI generative models instead of
Mm.
employing bandwidth there, because as I said, the entire model rests on good quality clinicians coming to small towns.
Mm.
Uh, Many others. So we use remote ECG machines with machine learning and AI interpretation, which we employ in small kasbas and clinics in villages where again, it's very difficult to read those ECGs by the local doctors there. So they do the ECG, the machine reads that and decides whether it is an abnormal or a normal ECG. And sometimes we call them first that, Doctor Saab, there is a patient of a heart attack in your clinic right now.
Mm.
The ECG has been done. So please start this treatment and we are sending an ambulance
Mm.
across.
Well
So a
said.
lot of technology is being used and we
Mm.
are really doubling down on employing as much technology as possible, because that
Fantastic.
is the only way we can scale up and expand across more units.
Correct.
Physically doing that will be very difficult.
Correct. Correct. And how do you use, or what do you see as the role of community engagement when it comes to the operations and expansion of your hospitals?
That is the key to everything. So if the
Mm.
community doesn't trust you and the community is not engaged with you, providing healthcare is very difficult, because the entire basis of providing healthcare is
Mm.
trust. You are willing to put your life in someone's hands. So if you don't trust that person, you will never do it.
Correct.
So we have a very scaled up and very big model called we call the Sehat Chopal.
Mhm.
So in a Sehat Chopal, we go village to village every day around all our 22 hospitals.
Mm.
So each hospital does at least one Chopal. Sometimes they do two as well. So every day we are doing around 25 to 30 chopals
Mhm.
around our villages. So we go
Right.
to the village and every chopal we see at least 100 to 150 new patients and community members. So every day we are screening more than 3,000 people, new people every day. So we go to the Chopal, we call all the influencers there, the Sarpanch, the Panchayat members, BDOs, everyone. They sit and then we talk about the prevalent disease conditions, health scares, what to do. Like right now, we are talking a lot to them about heat exhaustion and how to prevent that. When the monsoons come, we'll start talking about dengue, malaria, infectious diseases, gastroenteritis, how to prevent that. And then we do a generally preventive talk about anemia in women and about malnutrition in children, which is all pervasive. So we try and do a general awareness about health seeking behavior, try to improve that. Then we do a
Mm.
screening of all people for diabetes, hypertension, joint diseases,
Mm.
cataract.
Mm.
So because we understand that, in India, healthcare is not just underserved. We have been talking about this healthcare as a model of scarcity all our lives. No, we have less doctors, we have less nurses, we have less
Correct.
hospital beds. Everything is about scarcity. We don't have this, we don't have this, we don't have this. But we need to understand that Indian healthcare is not just we. So we go to a village. Uh, we see many of cases like, this is an old woman, she's lying on the charpai because, she's old, so she can't see, she can't walk. It is accepted that this is has to be. They don't know that if she can get a cataract surgery, she will be able to see. If she can get
Right.
a knee replacement, she'll be able to walk. If
Hmm.
we can do a hysterectomy for her prolapsed uterus, she'll be much more healthier. If we can
Hmm.
do a stone surgery, she will get rid of that pain in her abdomen that she always has. So
Hmm.
people are not aware of that. Surgical rates in India are less than a tenth of what they should be as per the Lancet Commission of Surgery. So we are missing 9 out of 10 surgeries because people don't realize that a surgery is needed or possible. That is why
Hmm.
we have the highest rate of preventable blindness in the world, because cataracts are not being operated on.
Right.
That
Absolutely.
is that is why we get most Guinness Book of World Records from India, because people are very happy. Oh, we removed this 25-kilo tumor, and they're posing with the poor girl, and photographs are being taken. That tumor should have been removed 10 years ago when it was a
Absolutely.
500, 200 gram tumor, right?
Correct.
Because so this all awareness exercise, this promotes better health seeking behavior, and that builds a trust in the community that these people are not just some hospital sitting in the city. They come to us, they talk to us, they are engaged with us, and this is how we build this whole community with us. And then we provide them free digital healthcare services, free teleconsultation, free sample pickups and drops, and free medicine delivery. So this community then ties in with us throughout. So it will be very difficult to penetrate that, barrier which we build around the entire village. So we own the
Hmm.
community in their full life cycle.
Hmm.
So that is the reason this works, because just building a facility doesn't really solve for most of these things that I talked about: awareness, availability,
Well said.
acceptance of treatment. Yeah.
Well said. Well said. So I have time for one more question, Dr. Bajaj.
Yeah.
How do you envision the future of healthcare delivery in India, and what role do you see for Ujala Cygnus in it?
Healthcare, I think, is an industry which has remained as it is for a very, very long time. See, you and I have both been to banks to update our passbooks.
Correct.
Now nobody will even think that going to a bank is necessary. Everything is online. We've been to shops to, do shopping, etc. Everything is done online. So every industry has changed dramatically since the advent of technology. We've been to taxi stands to go and talk to the taxi driver. Will you go? And then brought them home and then loaded the family and taken a taxi.
Yeah.
Now everything, is on your phone.
Hmm.
Unlike healthcare, healthcare started doing this in COVID a bit, and then unfortunately has slipped back into pre-COVID physical
Hmm.
consultation days, teleconsultation that
Yeah.
skyrocketed in COVID, but now
Hmm.
they're back. So that change hasn't stuck. But I think we are the only industry left like this. So we will be undergoing that digital transformation very soon. There will
Hmm.
something that will come which you and I both will think, oh, why didn't we think of it? It was so
Hmm.
simple. Something is on the anvil, something is on the cusp. So we are doing that. I think in the next 10 years, I think unless you are very critically ill to be an ICU on a ventilator, or you need a very big surgery,
Hmm.
I think these will be the only two people who will be in hospital.
Hmm.
Rest, everything will be home care. I think everything has to move towards that.
Hmm.
Every more focus on preventive and primary than curative, and more focus on personalized care,
Hmm.
with a lot of wearable devices, sensors telling you each and every time what is your blood sugar, what is your blood pressure right now, how do you prevent it, how do you prevent it from getting complications. So all of that, I think, is the future. We at Ujala Cygnus are really focused on that. We understand that this is happening. We are working with a lot of new age entrepreneurs to see what is going on, and we are focusing, as I said, even today, a lot on primary preventive and healthcare at your doorsteps,
Hmm.
which I think will move to a digital format very soon. And we, I think, will be the pioneers in that. We will be the first movers in that. We do understand that just pure hospital based healthcare will not really be what the future players will be doing. So that focus, I think we already have started developing.
Well said. And on that note, Dr. Bajaj, thank you so much for speaking to me. Thank you for speaking to me about your journey and how Ujala Cygnus Hospital started. I think you're doing some incredible work for people who have never really seen top grade medical facilities. Thank you for everything that you're doing for them. Thank you for speaking to me about everything that you're doing with communities, about technology, and also what you foresee as the future of healthcare. Thank you for speaking to
Thank
me and good luck to you.
Thank you very much, sir. And it's great to be on the world's biggest platform. The brand called you. It's a
Thank
great achievement, and I really congratulate you on that. And I
you.
look forward to seeing more of your podcasts. Thank you very much for having me.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.